Well, yeah, I think that everybody is kind of ready to move past COVID and start to get back towards regular life again, or what it will be after COVID, because it'll probably be a little bit different. And we can start to do that, but we also still have to understand that COVID isn't entirely gone yet. And so we still need to make sure that we're doing the things that will help protect us to stop us from either getting sick, getting other people sick, and risking further complications. We still want to encourage people to get vaccinated if they have not gotten vaccinated yet. Vaccination is still the best protection that someone can have against severe disease from COVID. People may not be hearing about it as often because luckily our cases have dropped, but people are still getting sick. People are still dying from COVID. I have a high concern about pregnant women. Women should get vaccinated while they're pregnant. We've seen some pretty horrible outcomes, pregnancy-related outcomes for both mom and baby if mom gets COVID while she's pregnant. Getting vaccinated while pregnant also helps protect the baby. You can still take other precautions like masking, like distancing, like staying away from large groups and gatherings. But the thing that's going to protect people the most is vaccination. If you do have an existing medical condition, if you smoke, because we've saw higher rates of COVID and more severe disease among smokers too, diabetes, hypertension, heart disease, anything like kidney disease, HIV/AIDS, then for certain to get vaccinated. Almost any medical condition, there's not a reason to not get vaccinated. There's very few reasons why a healthcare provider would not recommend that for someone. Almost universally, they're going to recommend a vaccination. The other thing is of course to make sure that whatever your medical condition is, that you're getting the proper care for that too. Because if your blood pressure is under better control, or you're in a better health status overall, then that can help if you do get sick to be able to get through it and bounce back, hopefully. While kids generally do okay if they get COVID, that we can see kids get very sick from COVID as well. And those cases are always tragic, and you don't know when or who it's going to happen to. So vaccination is still the best way to protect them. The biggest message is to stay vigilant. While we're in a great place right now, we've already seen, this is like our 5th wave of COVID surges, that it can change pretty quickly. And what people can really do is make sure that they stay up to date on their vaccinations. So, you may have had the first 2 shots, or you got 1 shot of Johnson & Johnson, and then you were eligible potentially for a booster dose. And now we got a second booster dose that just recently got approved for those who are 50 and over. So we have to stay up to date on vaccines. So even if you've gotten it before, your protection can decrease over time. So it's really important to make sure to keep your level of protection up, that you get those booster doses when you're eligible.